Michelle Borquez is the founder of BODYWRX, where she blends functional medicine, longevity, and aesthetics into one results-driven approach. Known for her meticulous care and concierge-level touch, she's trusted by A-list actors, athletes, and industry leaders.
Welcome to the show, Michelle.
Thank
We're so excited to
you.
have you.
Excited to be here.
Well, I came across you on Rachel Zoe's Instagram.
Yes, love
and I was like,
Rachel.
why the heck am I driving to the city to go get my peptides and all of my good stuff? And then when I researched you and was on your Instagram, I just love your approach, beauty from the inside out. So not only peptides, but aesthetics as well. And having someone come to your house, the convenience of it
Right.
is incredible. And
So
then,
wait, you come to people's houses? Is that
Right.
what's happening?
So it makes it really convenient for you.
Yes.
About 80% of my business is concierge. So
Yes.
going to people's homes on your time, on your schedule, and doing everything from longevity services like peptide therapy, IV therapy, NAD, I'm sure you know about that. And then even Botox and injectables.
Oh my gosh, this is
microneedling.
amazing.
So it's all in your
This
home.
is a
Right.
life-changing moment for me.
and we live very close to each other because it can
We'll
be a
have a Botox
one-stop
party.
shop.
Yes, I mean, we don't ever have to leave.
No.
Ever.
We have Postmates and we have her. That's it.
That's funny. Anyways, I did the consultation, and the one thing that I was real upfront with that I loved is I like the idea of someone being very intimate with me, if you will, but following me through the whole process, the blood work, making sure that I'm staying on track, because I think for me, the peptide thing is a newer, a couple years new, and I don't know. I don't know what to trust, what not to
Right.
trust. When people say they're FDA approved, they're not. So why don't we kind of back up and tell us how you got started, how you got into this, and what made you do the approach you're taking with the concierge service, which is genius.
And let's add, what exactly is a peptide? It's such a hot topic right now. Are you taking peptides? What are the peptides? People don't understand what they are and how you can take them. And I really would like to know, is there a certain age where you should start?
Okay.
That's a great question.
Great question. So to start with from the beginning, how I got into all of this, I was a bedside nurse at a hospital and did that for 3 years
God
and
bless
started
you.
doing.
Can you imagine this Punam, this face showing up?
Men are like,
Oh my
yes.
God. I'd be like, no, I'm staying here all day.
I saved so many. But it was great and very rewarding. And I'm glad I have that foundation. But it wasn't, for me, I didn't feel like I got the one-on-one time with patients that you really get when you're in home. And that's what I went into nursing for. Like I wanted to bond. And in the hospital setting, it's very fast paced and you're in and you're out of rooms. And the personal touch isn't really there the way that I wanted it to be. So I discovered concierge nursing through a colleague and fell in love with it. I didn't even know it existed. Made a lot of contacts with other concierge doctors and really fell in love with longevity pretty quickly. I've always been into wellness. I've been into like supplements very early on. My mom is super holistic. So I have that background
I
from
like
her.
that. That's a good balance.
And so when I learned about IV therapy, I'm like, well, of course I have to try this on myself first and make sure. I'm not a good saleswoman, believe it or not. I just try what, I offer. And if it works well, then I can sell it easily because I believe in it.
Well, when you walk in, people just say, we'll have what she's having.
Yeah.
What she's
Head
injecting.
to toe.
Exactly.
And it all just really did work wonders for me. And so I geeked out on it. I love to learn. I took a deep dive, started listening to podcasts, going to conferences, and eventually started my own company. So I feel very grateful to have grown word of mouth. My clients really trust me. And it's because I have that like deep, connection with them. I'm texting them directly. It's not a bot on a website. And I'm looking at your blood work. I'm asking you how it's going. We're deciding if this is the right course of action for you, how experimental you want to be, if you want to stay on the FDA approved list options, which changes all the time. But some people are a little more conservative that way. So it's just really understanding what your needs are, what you're looking for. And
Do
it's
they
going
put
from there.
stuff on this, like the FDA list, and then take it off and then put it back on? What's the criteria? Is there something that they're
There's nothing
measuring it against? Or?
So there's minimal research that's done on humans. It's all on rats, basically. And peptides as an industry is very, we're able to sell them as a research substance because there isn't a ton of research on humans up until this point. So a lot of what we're doing as practitioners is like just learning what we can off the cuff with our clients, essentially, and getting anecdotal evidence. But there is, it's not like they haven't been researched whatsoever, but it's not as extensive as a lot of people would like. The research we have shows how effective, and the anecdotal evidence shows how effective peptides really are. They work. They
the
help
buzzword.
people.
What are peptides?
So to your question, what are peptides? Peptides are short chains of amino acids between 5 and 50. Anything over 50 is a protein. Our body produces them naturally as we get older, and then our ability to make them decreases as we age. But our cellular need goes up in the sense that if we want our cells to function like they did in our 20s, we need more peptides to feel that way and look that way. But we can't make as many. So that gap between what we need and what we make is why we supplement with peptide therapy.
Does peptide therapy, are you chasing it? Sometimes you start taking it, you feel amazing, and then that you don't feel as amazing, so you want more and more. Does that work, or does it sort of just supplement your natural ability to produce them?
Yeah, can you overdose on a peptide?
Most of them have very short half-lives, meaning they're out of your system very quickly, which makes them very safe. And you can't really overdose. You would have a negative side effect, let's say, that would not kill you, but could be uncomfortable. Let's say you took too much of one of the GLP-1s. You're going to feel very nauseous. You might have GI issues, but that's going to clear from your system. Something like BPC 157, which is for inflammation, you can take extremely high doses of that and you're not going to feel anything. We're going to dose you dependent upon what your body needs, if you're healing injuries, things like that.
So full disclosure with BPC 157, that's my favorite. Mm-hmm. I can't live without it. And I like the oral form.
Okay.
I've tried the injectable one and I didn't feel anything, but I measure it by my thumbs because I have arthritis from texting. I'm like a master badass texter, and my thumbs are my number one support. And so when I run out of it, I'm like in so much pain. And then when I take it in, it's just one little pill. Yeah. And I also feel like it helps my digestion.
It does. Yeah. So it's actually made from gastric juices. And so body protective compound is what BPC stands for.
You're taking that orally.
I'm okay with that. I'm totally fine with that.
Well, the less we know.
She's like, gastric juice.
Yes.
In my mouth.
Well, I think that's fine because all of your enzymes, it's not strong as you age. So it's nice to help support that. Another question is, or a statement, I've heard that it's really good for surgery recovery.
Yes. So I use it in a post-op package that I offer along with one of the peptides called thymosin beta 4 or TB500 that helps with tissue repair. So BPC is going to decrease inflammation, helps with the gut, but usually for surgery, that's not what we're targeting. And it would just be in order for the body to repair quicker, less inflammation, and add the TB500 in with the tissue repair, and you can speed recovery by, in half the time, essentially.
I love that. Now, how often are you checking the blood to see how things are changing, and what are you looking for in the blood work?
So ideally, you can't start with me unless you've had blood work in the last year, ideally 6 months. And I don't force you to do it through me. If you have some from your doctor that I can see, great. But let's just talk about a GLP-1, for example, because most people know what that is. What a lot of doctors aren't checking for, some do, which is great, but you need to have a baseline of checking your pancreas, your thyroid, and and your gallbladder. So we're checking lipase, amylase, and bilirubin, then your total thyroid panel, and of course your hemoglobin A1C. And we need to make sure that these organs are functioning properly before we start adding in something like a GLP-1, which could disrupt that. And we can monitor that every 6 months if you're taking a GLP-1 to make sure that those numbers don't get out of range.
Are you also doing hormone therapy?
So I make sure my patients are very happy with whoever's managing their hormones, but that's out of my scope.
Okay.
So I refer to someone that I trust.
I like that too. I'm happy that you're saying that.
We can only do so much. And I'm a registered nurse and I have a lot of knowledge, but I'm not going to, hormones are so delicate and such an intricate science and art, I think, especially women's hormones. And so I refer to someone.
Art. That's a great way of putting it.
Someone that I really trust that does a great job, who's in Beverly Hills.
Yeah, that's great. And how young can you start?
So I have patients that have come to me in their 20s to start, and all these girls, they are starting things so young.
Yeah.
With skincare and preventative
But think about how
Botox and
great
everything.
that is, in the sense that, look, aging for them is going to be hopefully an entirely different experience.
Completely different.
Than it was like when I look back at my mom and pictures of my grandmother, they looked a different age than we do now.
Basically, the Golden Girls TV show, they were our age. They were our age.
Truly.
Like right now.
Yeah.
Yes.
Right?
Yeah,
Yes.
and that's so. Imagine these girls. It's like the fountain of youth. These girls now, these young girls,
they're never
going to
have
like,
a wrinkle. Nothing.
But they also internal health. Like they're going to feel good, and that's such a big part. I'm now.
They know how to exercise.
Yeah,
They know how to eat.
49, and I'm now starting to feel aches and pains that I'm like, what's that? Like in my head, I attribute it to something horrible each time, and then I forget that it's AGE. Like I forget that I'm aging. And
You are a little bit of a hypochondriac.
well, yeah.
You know, and I like that about you.
Yeah. I'm concerned.
Yes.
I get to the bottom of stuff. Yeah. But
Yeah.
it's a good thing.
It's a great thing.
Yeah.
I'd rather you be hyper aware.
Yeah. Michelle's like, great.
No, I have so many patients that
My
would fall
doctor's
into the
like-
caring category.
I like that. That's a new
He's like,
rebrand.
there's a bump. It might be, we might take a biopsy. I'm like, whoa. This was my podiatrist. And I'm like, you are going to take a biopsy? And then I call my dermatologist. I'm like, I need to get in immediately. There's something
What
on my
did she
foot.
say? You never told me.
Nothing. She said, don't be worried about it.
Okay, good.
She said that it's like almost like a mole, but it's the same color as your skin.
Yeah.
She can biopsy. I said, what would you do if it was your foot? She's like, you're fine. Don't worry
Good.
about it.
Yeah,
Measured
that's
it.
good.
Good. Quick care.
I told you I'm a very good patient though.
Yeah. I'm so
Very
excited because I feel like
proactive.
you're going to be really on top of it. And
Well, I'm your new patient.
Yay.
Wait, let's
I'm
show.
so excited.
This is our Judy Garland starter kit here. This is incredible. I mean,
I'm glad you like it.
no, this is like a jewelry box.
I know, it's amazing.
It's like, this is incredible. So this is what you brought to me for
So
my
that's all your
peptide
your
journey with
empty
you.
syringes for when you do need to pre-fill on your own.
because you've already had your consult, you've already done your
Yes.
blood
Yeah,
work.
yeah.
So this is what you're going to be going on.
Yes.
And then does any of this have to be refrigerated?
all of it. So it's on an ice pack right now, so
okay.
we're okay.
Oh, we'll put this in.
And there is a certain time that it could be out, like maybe 12 hours in like room temperature if
Once
God forbid
it's-
you're traveling.
Well, I say to travel with an ice pack.
Okay.
And be sure to refrigerate it as soon as you get there. As soon as it's a liquid, it needs to stay cold.
Right.
And of course, like an hour or.
But what about room temperature? So I've been
it doesn't
told, like,
even want to get to the
Really?
liquid doesn't want to get to room temp. If it's a powder, which all of these begin as powders before we mix them, those can be room temp. Those
Okay,
can
we
exist
We have
room
so
temp.
many questions.
I love you the second I saw this, because for me, a lot of it is the act of having to load it every morning, which seems daunting. So to have preloaded, and I will do this on a weekly basis now.
Oh my gosh. Let's go. I'm so
For-
into this.
Okay, when you go anywhere with Jen, you'll notice she's like a drug addict. You're sitting at the table and she's like,
Well, I take so many supplements.
the first time I met her,
well,
I'm
that's
like,
why y'all
what is
look
she
so good.
hiding from me? But she always has these packs now. Now we know each other so well. She doesn't care. She just like puts it on the table. Here's Jen at dinner with her.
Oh my God. Yeah. With my like Ziplocs of vitamins.
She's like, hang on.
I'll do anything. I'll do anything to feel good and look good.
Okay, so this is exciting.
So that's about 2 weeks for each of them, and then
Preloaded. Okay.
and that comes included in the package.
Okay.
But I do have clients that are completely hate doing this all on their own, and they pay me above and beyond to fill every single one of the syringes.
it's so
interesting.
smart.
So I have done a lot of peptides, and I would say the two questions that I get from people who watch our podcast and listen to it, they say to me, please talk about what peptides are on and please talk about your skincare. So I'm so excited to go on this, podcast and talk about the peptides. And
what peptides are you on?
I am on BPC 157.
Yes, your fave. Okay.
My fave. I was taking, is it thymosin for like your, my white blood count was low.
Okay.
Is that what it's called? Thymosin something?
There's like a thymosin category of peptides.
Okay.
So that would be like thymosin alpha 1, which is for immune system.
Yeah.
And then thymosin beta 4, which is the TB500, also TB500, that helps with tissue repair.
Right.
And then thymulin, which I don't offer, so I can't speak to that one as much, but yeah.
I also have taken copper, but it kind of burns, so I feel like
It stings a little.
right, it does. So I get
Someone
annoyed by
said
that.
to let it get down so it's not as cold.
If
Room
you
temperature.
right before you
Yeah.
inject, if you let it get to room temp, that's fine.
Right.
What my thing with the room temperature is, don't let the vials sit out. That's how they
Oh,
can.
that's smart.
Yeah, but to let the actual syringe get to room temperature can help with any of the stinging when
If
you
you
inject.
Okay,
were
that's
to
a good
give
idea.
like a peptide stack to women of our age,
Yes.
is this kind of like what I have here? Like we could go through these as like a generic, like any woman of our age. Like there's nothing here that's special.
These are things I've never heard of. I have to be
me
honest.
too. I had never heard of some of these.
I
Like,
take one more peptide. Well, only in the summer. I do melanotan too.
Oh, you do? Okay.
Yeah.
Okay.
And I like it. However, you get a lot of freckles
Yes.
from that.
Yes.
So
because it's increasing the
Yeah.
melanin production, and if you have any kind of like, I can't take that because I'm predisposed to hyperpigmentation on my face, and so I don't want to even risk having that get worse.
Yeah.
And so that's the freckle.
and I heard
aspect
that
as well.
there's melanotan 1 and melanotan 2. So the 2 gives you more freckles, and the 1 takes longer for you to build your melanin, but you get less freckles.
Less freckles, yeah. So just patience over immediate results.
Right, exactly. But that's like that helps me when I go somewhere like really sunny and I just don't want to worry about a sunburn. But these are amazing, so I feel like we should just talk
let's
about
walk
each
through.
one.
Well,
Yeah.
let's go through the two ones that are most known and common, like the copper, which is
Yes,
the
the
GHK,
GHK.
and the NAD. Like if you could talk briefly to how those benefit women in our age group, which is, we hate the term middle age, but
Right.
45 and above.
Absolutely. So NAD is going to benefit anyone. And to back to your question about how young you can start in your 20s safely, even with the GHK. But specifically for your age group, it's helping because your NAD levels are going down and your collagen production is going down. And our collagen production decreases because our estrogen levels are decreasing around this time. And those two things play a part with one another. So the GHKCU just really helps to not only rebuild collagen production, helps with tissue repair a bit. So it's also helping the lining of anything in your body, organs, and helping with any injury repair a little less intensely than something like TB500, but still helpful. And that's commonly why it's stacked with the BPC and the TB500. And then it also helps with hair growth.
This is the GHQ.
This is the GHKCU.
Okay, CU.
So the hair growth thing is, I've had that work for people who are even completely resistant to every other treatment
That's amazing.
and have this as a congenital, it's a family genetic thing. And they, tried everything from PRP injections to red light therapy to this and that, and nothing's working. And they try the GHKCU and they finally get results.
And you can stack these, right? So stacking means you put whatever your 10, is it milligrams, micrograms, milligrams? Is that what you call it?
Units.
Units. Okay, so 10 units in a syringe. And then you go to the next one and you also, so you're only injecting yourself
With-
one time.
Right.
Because that was my rookie move where I was like, I'm giving myself 3 shots in the morning. And that's like really gets old very fast.
You'll notice, though, I did not stack any of yours.
No. And I think I did tell you this, that it's like a thing for me. I enjoy this. I enjoy a shot.
She did tell me this.
I have an aversion to taking pills. Even driving here this morning, I took the smallest supplement in my car. I drank the half a thing of water and it was stuck, and I'm like, shit, now what do I do? And I was so annoyed. I had to eat something to get it down. So I would personally rather give like 10 different shots than have to take
I'm
any
the
kind of
worst. Here's what
supplement.
I do. And my doctor friend was like, Jen, you're torturing yourself. I take this little needle and I squeeze it and I like touch the skin to see if it hurts. I'm like, ow, no. Ow,
Not
no,
there.
Ow,
Nope.
no. And then
You know
there
what?
are certain areas that are kind of like numb where you don't feel it and then it
Yes.
goes in.
Yes.
But I think I should just be brave and go,
Do it here.
yeah, no, we're going to.
You don't feel it here.
Really?
Yeah, I do it here.
Well, we're going to do some
my
shots
stomach.
today.
I
I'm
do
going to
my
borrow.
arms.
I'm going to borrow some of your shots.
I do anywhere where I can hide a bruise that I have
Yes.
an outfit in the next 5 to 6 days where a bruise would show. So I, like right now, I'm working here.
Okay, that's good. Okay, so NAD, that's another big one.
That's a huge one.
Question for you. I've seen on Instagram, and I don't believe everything I see, but kind of.
Goes on Instagram, it's true.
Yeah, is like, can it cause cancer?
NAD.
Yes.
So this is newer that's come out, this fear around it. And of course, there's not a ton of research that's supporting this statement, but the thought behind it, let's talk about that, would be that it's accelerating cellular turnover. And so if you were to put that into the context of a tumor or an unhelpful cell in your body, we don't want that growing faster. So that's the fear, and that's kind of where this is coming from. But I've never in all of my years, and it's over 5 years of really working closely with these medications, I've never had anything like that happen with my clients, and I have hundreds of clients. So me personally, I don't see the correlation, but I'm very open to learning and research. If something comes out that definitely proves that, like, I will eat my words and take that back. But as of right now, I'm 100% a fan of NAD, and as soon as this baby pops out, I'm going to be back to back on my routine with it.
What's the difference between CJC ipamorelin and NAD?
So totally different. NAD is a coenzyme. CJC ipamorelin is a growth hormone secretagogue. NAD helps with energy levels and mitochondrial function, reverse ages you, it repairs and regenerates your DNA, helps with brain fog. It's really the energy driver of the cell. And then we have the CJC ipamorelin. You take that, and then your pituitary gland releases more growth hormone.
Oh, I see.
And growth hormone is what we have an abundance of in our 20s, in our developing years. And that's how we could, and this is what I described to you on the phone as well, that's why we could eat, Taco Bell in our 20s, work out once, and then we'd have a 6-pack. Like,
right. Or you're like, I need to lose weight by this weekend.
And you can. Yeah, exactly. And we just can't do that anymore. And it's because our growth hormone levels have dropped significantly. And
is that what you put me on or no?
I put you on IGF-1. I just feel like that you get the best results. CJC, IPA, I've tried it, and I've tried all these. So that's why, and I have a lot of clients that I've put on. It can cause bloating in women. Not all women, but some women. And no one's going to want to deal with that. So if there's something that's never caused bloating for women and I get really good results in lean muscle, then I'm going to recommend that for you instead.
I've taken that, CJC, under my tongue.
Oh, you like the oral? Yeah.
I'm fine. I just, one less shot is good for me. But I had the weirdest thing. I got like these sores under my tongue from it. Yeah, so I kind of cut that out. And I don't, growth hormone, I don't know. I'd rather do NAD.
I got herpes from it.
No, I real like blisters from them under my tongue. Yeah.
Like from one or from doing it?
No, because I did it, I think 5 days a week.
Was it like an acidic?
Yeah,
like
it almost looked like a waxy little square. It's called, I don't remember what they're called.
But not like a canker sore?
No, no. Like really just a reaction to that in particular.
Yeah, interesting.
Yeah, but if I could stack it, I'll take it.
Yeah.
Right?
So, back to the stacking thing quickly. I didn't stack yours, not because you love a shot, and I wanted to give you every opportunity to poke yourself.
Can I give you a shot today?
Yeah!
I'm so excited.
It's so exciting.
I'll let you pick the location.
Okay.
Sexy. But because you can't stack all of them. They're not all created equal like that, and some of them aren't compatible to put in the same syringe.
Okay, good.
So it's very specific, yeah.
And most peptide practitioners should be aware of that. Like, would it be dangerous to put some things together?
They would just not necessarily have the same effect.
Okay, so the efficacy is a little less than it.
Little less.
Because there's a glow shot, which is
TB500, BPC 157, and GHKCU.
Okay.
And all of those can safely stack.
okay. That's good.
And then what does that do? What is that?
Well, because that's decreasing inflammation, building collagen, helping with hair growth and tissue repair. It's really just meant to give the body an overall glow. Because think about it, if you are someone who drinks or you haven't been sleeping well and you're inflamed, your skin doesn't look as good. So the BPC kind of cuts that down. works synergistically with the TB500 to heal anything extra going on in your body that might need healing. And then you throw in the GHK for the extra glow, and you know, that's why they kind of coined that. It's one pharmacy specifically that did that, and now a lot of practitioners are just taking that on.
Shot.
Yeah.
I do recall the CJC helping me sleep. So I know there's like a new sleep peptide. Do you know what that is?
So it helps you sleep because the growth hormone helps you sleep. And the newest, or I guess newer because it's getting popularized, is epitalin. Is that the one you're thinking of?
I don't know. All I know is it helps you sleep, and I was like, I need that on my list.
Yeah.
But if you're taking something like that, I guess it's probably like progesterone. It doesn't like stay in you where you're drowsy the next day.
No, not at all.
It just
actually
helps with like your regular like great sleep patterns and.
So you wake up feeling more rested.
Let's put this on my list.
Okay.
Okay.
We'll add it. I'll put it in your notes.
Okay.
But it helps to your body to produce more melatonin naturally. So you get it also like NAD, how NAD repairs and regenerates your DNA. The epitalin repairs and regenerates your DNA overnight, lengthening your telomeres. So you're actually getting this repair factor and better melatonin production. So you're getting more restful sleep, and you wake up feeling better and more energized. I put this, I use this often for my perimenopausal, menopausal women, because they across the board tell me the same thing.
Yeah.
I wake up at 2, 3, 4 a.m. It's
3:11.
usually
It's
around.
like not getting to bed, it's staying
Staying
asleep.
asleep,
That's
and
the
everyone
problem.
wakes up around the same time and for about the same amount of time, and it's so consistent. It's so fascinating that this is happening to us. And they do the epitalin, they start on it, and sometimes the first night, sometimes within a week, they're sleeping through the night.
Okay,
for the first time in
amazing.
ages.
Hallelujah,
Yeah.
sister. This is what I need.
Yeah.
Yeah. Sleep is a major issue for women 45 and up.
Yes.
Yeah. I saw the funniest meme the other day. It said, I woke up at 3 a.m. again to worry for 3 hours about things I can't control.
100%.
And it's like every night that I do wake up, I look at the clock, it's 3:12, and I'm like, shit. And then, bless you, I am
you.
thinking about things that are so out of my control that I can't do anything about them right then and there. And
Well, again, during perimenopause, we are also, everything's heightened for anxiety as well. That's another common side effect. So on top of the same time waking up every night, not being able to fall back asleep, now your mind is racing because there is a little bit of more anxiety during this time period as well.
Yeah.
So it's just like wham bam.
I mean, the peptides are crazy. Like what
It's a gift.
What has come out, like the research and all of the information in the last, I'd say, year and a half, 2 years. This is incredible.
It's the future. It's truly the future.
And who found this stuff? Like, what?
Well, insulin was the first peptide, essentially. And so that's how it got commercialized.
That's wild.
But there's a lot of this research is really done in Russia, and then comes to America. And then we, I think, did our own research, and it became a lot more popularized. But it's been around in the bodybuilding world for quite a long time, the sports world for quite a long time, except they can't technically do this all the time because a lot of them are on the WADA list. Like BPC, your favorite, is so effective that it's banned. Sports, anybody that gets tested in the sports world cannot take it.
Wow.
And
That's how effective it is.
Isn't that one that was on the FDA and then they took it off?
Yes.
It actually pisses me off because
It's a huge money play. It's a huge money play.
it
They
drives
can't,
me, like,
so they can't
let's help
capitalize.
people.
And they can't capitalize on something that's naturally occurring, like a peptide. And the only thing that they have been able to make money off of course, is the weight loss medications, because they were used for people with diabetes initially. And so now that it's mainstream, they can, like Eli Lilly and they've created a way to make money now, and also use it just for obesity instead of for diabetes.
Let's talk a little bit about the one that you put me on. And
Yes.
for most people, it's like, she's so thin. How could you ever go on one of those? And
Which one?
it's microdosing,
Retatrutide.
so that I'm
It just
getting,
says Retta on it.
so I'm going to get
so
the
Retta.
benefit of the GLP-1 without any of like the effects
Muscle
of like
wasting.
weight loss and all of that. So I'm
Yeah.
going to get all of the effects are like good for my heart, good for cancer prevention.
So Retta
good
is a
for brain fog.
microdose GLP-1, basically.
Yes, and it's the newest generation of the
Okay.
3. So the first generation was semaglutide, That only worked on one receptor, GLP-1.
Right.
Second generation tirzepatide, that works on GLP-1 and GIP. And retatrutide is now the newest. It works on 3 receptors, GLP-1, GIP, and glucagon. This just means it's more effective, has less side effects, and in theory is supposed to have less muscle wasting, which is a big issue for a lot of people. I personally, and again, see with my clients that if you're having enough protein, if you're someone who works out and you're not relying on this as a crutch, that this is you're going to be able to maintain your muscle mass a lot better than someone who's just taking the medication and not doing any lifestyle changes. So this is more effective. I've seen it work with clients in a microdose way. This is just helping decrease inflammation in the body. It's helping protect your heart. It's helping prevent breast cancer. The research on these is wild.
Incredible.
And everyone was so afraid of them, rightfully so. It was brand new. We didn't know what we were doing in the beginning. And
I also think, like, let's call it what it is. When people start looking good, all of a sudden the world becomes haters. They're like, she's on a GLP-1.
Yeah.
Who gives a shit what she's
cares?
on? The girl looks good.
Great. And feels great.
Good.
Yeah.
Like, good
More
for them.
importantly.
Yes.
Yeah. You feel so, like, again, another one I can't wait to go back on. And not just for the weight loss benefits and weight management benefits, but truly you feel looser, your joints feel better, and that's because you have less circulating
With the
glucose
Retta?
in your system with any of the GLP-1s, but Retta specifically, because it is so effective.
That's amazing.
You do feel great.
There's 2 more on here that were super interesting. What's the one that you put me on for the brain fog? Like, it's a cognitive one.
The Pinealon, is that in there?
Is it
No,
the
you have
PT?
PT141.
That's sexual health.
Oh,
yeah.
okay.
You
Let's
took
talk about
that,
this
by the
one.
way.
Oh, I did. Well, I took like
That's the one that
a bootleg one.
Yeah,
It didn't work. It didn't do it.
But we talked about it, and if you do it in,
Let's do this today. And John will thank you later.
why don't we do it with our sex doctor?
Oh my God.
Oh, that's fun. That's so fun.
Okay, yes.
That's the injection
So this
she's
is
going
the
to give
sex
me.
one.
But that
PT141.
when you did it, I remember there was like a number he's like, don't do this much. And I'm like, well, how much did you do that you didn't feel good? And you're like, I did this much. And
I
I'm
think I
like, you
felt
overdosed
nauseous.
it. Yeah, you overdosed it.
Even with that one, you need to start very low and work your way up. So you start with only 10 units and about an
3
hour
times a
before
week.
Intimacy, maximum of 3 times a week.
Oh, maximum.
And you can work up to 30 units.
Does it stay in your system throughout the week?
No, it's
Okay.
just for the day.
How long does
Okay.
it work
So you can
through?
only have sex 3 times a week.
Sorry, babe. 3 times a week.
Well, you could do it multiple times in that day, but it's only
Exactly.
But you
3
don't do
days a
this.
week.
It's not like Viagra or Cialis where you would do it. You would take it
And you're like,
an
have an
hour
hour.
before.
You're like, let's go.
You like do it regularly 3 times a week just to keep it in your system.
No, it's to enjoy intimacy more and to have greater satisfaction.
So you have to have like preparation. You have to be like,
yeah.
so like, you know,
My
you're-
ladies love that. It works for men too.
Oh.
And it's not Viagra because in the sense that it's not just having blood rush to organs. It is working on the central nervous system for arousal.
I share.
Okay.
Yeah.
It's so interesting because I have a doctor in Chicago that I've been using for this, and he wanted me to go on like a Viagra pill, like just every day. He said it's the best thing that you could do for, that these tests were done only on men, but women benefit from the vascular flow of it all. And I went on it, and I'm a very sensitive. I went on it, and my hands were getting so swollen, and I had a dream that night that my hands and my feet turned into croissants, so I couldn't even like move my hands. And I was like, I can't take this pill. Like, it's just making me so like kind of swollen. So that wasn't worth it for me. But I love the cardiovascular benefits of it. That made sense to me. So does something like this do it, or there's other peptides that are good for cardiovascular health?
No, yeah, that's not going to be benefiting
just-
you in that way. This is purely for
Wouldn't
just
like
around sex, yeah.
GLP-1s be cardiovascular?
It does. There's actually very interesting new research that came out that says that GLP-1s separate from the weight loss. So if you eliminate the fact that it helped you lose weight, because of course, if you lose weight, your heart's going to function better. It improved cardiac function in the subjects separate from the weight loss.
Amazing.
So these, like, I think we're just really
And that's
tipping
just-
the iceberg of what these things are
Is that
capable
just
of.
blood flow? That's what that is?
It's the circulating, if we have high glucose circulating in our systems, which is just, you know, glycemic control and insulin resistance happens that way. But it also wears out our blood vessels because it's a large molecule. So that's how people with diabetes end up with even eye issues, kidney issues, heart issues, because the glucose molecule damages their.
Then they had all the worry about like vision loss with taking the GLP-1s. And then the new one, which made me laugh so hard, was a puffy
puffy pussy?
Puffy pussy.
I have not heard that.
Puffy pussy.
I don't know. Google it. Not that Google's
Puffy
answer.
pussy and GLP-1.
I don't know if you should be putting puffy pussy into Google.
It's such a good name, puffy pussy. I love it.
I
a
think you
croissant
might get
down
some
there.
unwanted side effects.
But that is something that I have heard is a side effect.
Wow.
So, I mean, but
is that a complaint or is that like a positive? I don't know.
I think that's a complaint.
Okay. I mean,
That's
I
like-
don't know.
That's a big toe in a pair of pants.
I hadn't heard that. That's very funny.
Yeah, you'll look it up.
I
Okay,
will.
Chat GPT.
I'll chat GPT it.
That's
yeah.
better than
no
Google.
images. Yeah.
Google, you'll get like.
Is there a peptide for like calcium scores? You know, people that have higher calcium scores with their heart tests.
So great question, and no, to answer it very quickly. But I do have a protocol that I'm waiting for the specific client to get retested to see if it did help with an IV that helps with it. Alpha lipoic acid, which is a very strong antioxidant. Have you heard of glutathione?
Yes.
I take
So
it daily.
it's like glutathione but stronger because it's universal. It goes into it's fat and water soluble, so it goes into all tissues, crosses the blood-brain barrier, and it's just extremely detoxifying. Helps with heavy metal detox, and some research says that it can help with at least maintaining the calcium score and not letting it worsen. So I'm just hoping when he gets his lab work back that we really do see that. But it's the first patient I've really tried this with, to be honest.
There is something called Plaquex where it is an IV. It was, I think, invented in Sweden or something, and that is supposed to really help. I actually tried it, but it burned so much that I couldn't finish the
Like it
IV.
burns.
It burns.
Burns going
It
in.
burned so much. It was like
Yeah.
you're like on fire. Also, I think the phlebotomist was terrible. She like couldn't, find my thing. So that's a whole other thing. But I want to.
yeah.
Okay, so let's get into what's this? Is this IGF-1 LP3? Is that what that is?
LR3.
Oh,
Just gonna
LR3.
take a sip of water.
These are so fun.
Yeah.
Pick
Empty
which one,
stomach.
and then we're gonna put them in the fridge. Which one are we gonna shoot each other with?
Which one should we shoot each other with today?
A PT 141.
The sex one?
We're like, we'll be right back.
And for a quick break,
With each other.
you could do the GHK. That's very low impact.
Oh, that's the copper.
the collagen one.
Yeah, but that. What about we? Just
Oh, that
do
stings
NAD?
for you.
I mean, it's fine if it's not cold. I could do it. Okay, but I just want to talk about the last.
Oh, the IGF one.
Yeah, the
Yes.
IGF one. Yes. What's that?
So that one is in the same vein as the CJC ipamorelin that we talked about earlier, except it's not a growth hormone secretagogue, meaning it's not telling the pituitary gland to release more growth hormone. IGF-1 is the byproduct of your pituitary gland releasing more growth hormone. So growth hormone tells your body to make more IGF-1. IGF-1 goes and does the thing. So that thing would be building more lean muscle, boosting your metabolism, helping with sleep, like you mentioned, collagen production, energy levels, recovery from workouts. So that's what you're getting directly. It's an IGF-1 analog. And the way that we test growth hormone like functionality in people is through IGF-1 levels on your blood work. And so this is just kind of bypassing the pathway and just directly affecting IGF-1.
Amazing.
And there's no negative feedback or negative feedback isn't the right word, but there's no worry that it's going to stop your body from producing growth hormone on its own.
That's not the workout one, right? No.
That one does, yeah.
That one is. What is the one that we were talking about for brain? Was that the SS31?
SS31 is mitochondrial function.
That's what it was.
Yeah.
Okay.
So SS31 helps with mitochondrial function. Mitochondria are like a major biomarker for longevity, and that's why NAD got so popular, because that was really the first time people are hearing about, like, what are mitochondria? No one's using that in mainstream verbiage ever until then. And so This really just improves their efficiency, meaning they can get rid of oxidative stress more easily. They're decreasing inflammation, helping. That one actually helps with heart health, brain function, and more energy levels because your mitochondria are working
So
better.
you can pair that with the NAD. That's a good.
do that.
Absolutely,
match. Okay.
yeah.
Let's do
You're
that
not
one?
stacking
Yeah,
them,
okay,
but
that's good.
you can take them.
The NAD that I've seen in supplements, like liposomal squeezy packets, does that have any effect, do you think?
If you're going to take an oral version of it, the liposomal is going to be great. Even better would be something like NR or NMN, which are precursors to NAD. So NAD, again, another large molecule, difficult for your cells to absorb. But the precursors to those are just going to tell the cell to produce more NAD. It's a better way to go about it. And there's actually new IVs that are just NR IVs, nicotinamide riboside. They're NAD precursors that are supposed to be better absorbed than just infusing NAD alone and increasing NAD levels 3 times more than just taking NAD. Wow. Yeah.
That's
so
amazing.
there's so much.
You have
that's
a
so
good
fascinating.
memory. There's like
you.
so many things to think about. What about MOTS-C?
MOTS-C's easy because it's a once a week shot. It does across the board cause itchiness and redness at the injection site temporarily, but it's extremely effective. Some people are really turned off by the itchiness. I get that. But it helps mitochondrial function, which again, we all want. But it also improves the way that we utilize our nutrients. So it's helping with fat burning and muscle building. And what I've noticed with that is if someone is working out regularly and maybe they just need a little help with body composition, just like that little nudge, and they don't want to do a GLP-1, MOTS is a really great option to get a bit of adjustment in the body composition, positive adjustment, without doing a GLP-1 if there's someone that's
It seems
still
like
worried.
a lot of these kind of overlap a little bit.
They
like
do.
They kind of help a lot in the same areas.
Mm-hmm.
If you were to pick for like the Superman or Superwoman of these peptides, so you can pick one or two of them. What are they for women of our age?
NAD. I say that for everybody across the board, man, woman, doesn't matter. If you want to get started on a longevity journey and you want to cover a lot of bases, that's the way to go about it. So it's just getting the most bang for your buck. You're, like I said, affecting your sleep, you're helping sleep, improving performance and recovery, decreasing inflammation, helping brain fog, making yourself biologically younger. It's like, what isn't it helping
Maybe
with,
we do that
basically?
one, Jen.
Do
And
we have it here?
yeah, it's in there.
Let's do
Okay.
that.
I'll do
It's
it
in
all.
the mix.
Let's
Yeah.
do that.
Let's be biologically younger today.
Yes.
And then most women, it's a really easy for me to say, do you want more collagen? Yeah, of course. That's, the GHKCU is really helpful for them. But I truly, truly love to cater it to what your main goals are. So if you have issues with sleep and she doesn't, I'm not going to recommend Epitalin right off the bat for both of you.
Right. So take me through this. You get a blood work, right? You see maybe if there's some deficiencies, if there is some inflammation, and you cater it to them.
And just your main concerns.
Right.
Just I talk about your lifestyle as well. I talk about sleep. I talk about workout routine. So I'm getting a global picture of your life to see what it is you really need and what we need to prioritize. Because if this is new to you and you're spending your time and energy injecting yourself with a shot, I want you to get the results that you want
Yes.
fastest.
Yes.
I don't want to just be like, oh, well, here's a cookie cutter approach that all women can use. Well, what if you didn't want to build muscle? Like, that doesn't sound like that's your main concern, right?
Right.
I've heard you say that now.
Yes.
But I feel like I would say, I heard you say that sleep is an issue. So I think Epitalin is a must for you.
Right.
And then build from there.
Yes, preach. Let's go.
Yeah. But if your
Yes.
blood work has any issues, that's where then I need to customize it even further based off that.
So I have another question.
Wait, I'm dying of laughter. I go,
What?
Yvette, can you please refrigerate that? And she's like, puts it down. I go, no, the refrigerator. She's like,
We don't have one. We do not have a refrigerator. We're on a tight budget over here at what she's having.
so how long can it stay off? Should I have someone come pick it up?
She has an ice pack.
There's an ice pack in it.
Yeah.
Okay.
Fine.
And if you were traveling, it would be,
Fine.
like that.
Okay.
right now. So
Oh my
it's
God,
okay.
I'm dying.
That's so funny.
I was like, no, refrigerate that. She's like,
She's just
I
holding
remember
it.
I set this by refrigerator. Like, we don't need one. I'm like,
I
okay.
said that, yeah.
Never
Bite
listened
your
to.
tongue.
well, we didn't know we were going to have Michelle on.
Well, we could refrigerate champagne. We could, there's things that are
know,
important that we
okay.
could refrigerate. Well, next week we have a shopping list. So if you are dealing with somebody who's actually not healthy and you want to help them in their recovery, for example, my mom just had colon cancer surgery.
Oh, I'm sorry.
And so she's in the hospital. She's in actually rehab now after 32 days in the hospital.
Wow.
And I'm just looking at her. I'm like, how can I help her? I want to get her healthy and moving and take down the inflammation, because I know that her blood work already showed inflammation. And I've been reading that cancer shows up so much earlier than actual tumors. It shows up in inflammation and other things in your blood.
Yeah.
Can you tell me a little bit about that?
So, given I don't know any other health history about
Yes.
her at this point, just assuming we're talking about the cancer alone and the post-operative portion of it, the safest place to start, and because it is one of the safest and well-researched peptides of them, would be the BPC.
Yes.
And I think intuitively you probably would have felt the same way about that. And then she could stay on that for quite a while. Initially, if someone is coming out of surgery or has an injury, then I have them taking BPC twice a day. And
Orally or injectable?
Injectable.
Okay.
If she needs to take it orally. So I don't really offer many oral options. I can get them through my pharmacy, but it's just I like to go with the most effective version. But we could offer her that if she needed it. I would say take the injectable if she can. And you can even inject near, so wherever the injection site was for her or surgical entry site, not directly on it, but close to it. And you can get some more localized help that way with the BPC.
neat.
It's the only peptide that you can do close to an injury like that.
So, like,
love
for
that.
instance, if you had like a knee surgery, you do it
You
somewhere
could do
close
it. So
to
if
that.
like somewhere like you have your surgical line somewhere around here, then you're going to want to do like over here, but close to it.
Now, when you're injecting these, do you have to do it in those areas? Like, I've always been told you do your stomach, you do, like, you have to find like close to a muscle, or is that wrong?
Fat. So you're trying to inject into any fat, but like both of you, you're going to have a hard time finding that. So you kind of have to get creative. And next to the belly button is the ideal place to inject subcutaneously. But
And these
you're
are
not going to have a
very-
ton of fat there. and
These
it's
are
gonna
very
burn.
small needles. These are
Tiny.
Yeah, they're so
they're
little.
tiny, like
Tiny insulin syringes.
insulin
yeah.
syringes.
Yeah.
You can also do booty, upper and lower.
Can you do? I do like this.
Love handle area. Yeah.
Arms,
because I was
right?
doing my
Arms, back
stomach,
of my
and
arms.
they told me
Arms,
not to
yep.
do my stomach because it's
I-
very sensitive.
I don't
And
do my stomach.
Next to my belly button is the worst.
I do right
Yeah.
here. I just
I
sit
would always
down
go
and
love
I-
handle and booty.
Yeah.
Yeah.
Yeah, that's kind of what I do.
And you just have to be careful. If you ever end up doing hormone replacement with a larger needle, don't get in the habit of injecting in this area, just because of like femoral artery and stuff like that. It's more inside, but just be careful.
See, I was never
Oh.
told that either.
Yeah, that's interesting because I've done a peptide in my leg
Yeah.
and then I have a huge bruise.
But these are so little. I feel like the place I bruise the most is my stomach.
yeah.
Yeah. So
Same.
like during the
I've
summer.
never bruised in my stomach. That's so interesting.
Do you feel like it
always
happens more
do.
when you do below the belly button line? I feel like that happens most often.
Probably, because that's usually where I grab. But I typically, like in the summer when I do my peptides, I always, and it's funny because I think everyone probably thinks I'm on, like when you go out, they're like, oh, she's taking a GLP-1, you
Right.
know?
Yeah.
When I'm out and about, like in a bathing suit, but I always bruise there. It's so weird.
I know. It's my least favorite area. And I tell women that.
Too.
I'm like,
that's the most painful part.
it's going to
Jen,
hurt the
to
worst.
inject.
You can bruise there.
I'm telling you.
In your stomach?
Find
Yeah,
your arm,
front of
find your
stomach.
leg.
Yeah. I mean,
This-
I don't mind
the back fat.
The back fat is good. I got plenty there. That's fine.
One thing of interest that I know that I text you when we hung up last time is
Yes.
those, and correct me if I'm wrong pronouncing this, the axioms.
Exomes?
Exosomes.
Exosomes.
Exosomes, yeah.
Like those fascinate me.
They're
Is that
fascinating.
Skin? Is that something for your skin?
Skin, and you can take them IV.
Oh, is that from umbilical cords?
So different ways to get it. There's completely plant derived, umbilical cord, and adipose tissue, which is fat.
Isn't umbilical cord like the most?
Going to be the most potent.
Yeah.
And you can get that in America?
You can get that in America.
We're like
not FDA approved. Again, we're all just operating in a
I don't
gray
know what
area.
you're doing with your umbilical cord, but if you would like,
right.
we are.
Right.
We're in the market.
Yeah.
We're in the market for an umbilical cord. So.
And yours looks really good to me.
Highest bidder. Sorry, I was.
Yeah, your exosomes. Exosomes are probably very good.
Yeah, they look pretty good to me.
There's a couple other offers on the table, so we'll see.
You're like, I'm doing my own.
But we'll
I
have
do
your placenta lasagna.
Yes.
We'll do whatever it takes to look good.
I'm making some of those pills for sure. Yeah.
I mean, that's incredible. When I was pregnant, if they knew now or then what they knew now.
Yeah.
Yeah,
My
I would have
sister-
eaten mine,
Why not,
drank
right?
mine.
Yeah, no, my
smoked
sister.
mine.
My sister is.
However.
My sister's a doula. She had her baby, and she made a lasagna, right? A lasagna from her placenta.
Did you eat it?
No, I would now.
Would
now
you?
that I
Okay,
would.
Here's a good question: would you try my breast milk, my colostrum, knowing all the health benefits?
Yeah, totally. Because it's sweet. Like, because I tasted mine, I was like, oh, that's like sugar water.
Yeah,
mine
I'm
was, like,
so
clear.
curious.
Yeah.
We'll find out.
Oh,
I mean,
I'm
I
gonna
did.
have yours. Yeah.
It's like you have to taste it because you're like, what do you like about it?
all
It's
the-
literally sugar water.
That's
and
what
all
I've
the
heard.
benefits that come from having a baby, it's incredible. Like everything great. From
I've
your
heard from
You
friends
can eat
that-
everything, drink everything.
I've heard from friends with the breast milk, like it even heals skin. Like they're like, you can put it on a
Yes.
pimple and it
Remember
like the pimple
Kim
go away.
Kardashian putting it
Courtney.
on,
Oh,
her
eczema.
eczema?
Yeah.
Oh yeah.
Yeah.
That's
Yeah.
right.
Yeah, well, think about it
I
now,
think
like
she
all
used
the
Courtney's milk
colostrum.
for it. Yeah.
She's probably buying milk from like the princess of.
Definitely someone that's just getting fed exosomes.
Yes, exactly.
And they
That's
have
so good.
Great,
Let's
great
be
system.
real. She's getting milk from like the higher powers.
A goddess. From
The
pure
fountain
goddess.
of youth. Yes.
I would
Yes.
too.
Yeah.
Yeah. Now, all the things that people did that I thought they were wackadoo, I'm like, okay, they were so ahead of their time.
So
And
ahead.
I absolutely will have a piece of your lasagna anytime.
I'll find a good recipe for you. I'll ask your sister for hers.
So tell us what you do, like around that.
Typically. So prior to obviously being pregnant, I was doing the most. And honestly, I think it helped with fertility. And I was doing an NAD and NR. So I started combining them. NR, I mentioned earlier, increases NAD levels 3 times more than NAD alone. And I do that twice a month. That has all the vitamins and amino acids. It's a vitamin bag as well. Follow that with alpha lipoic acid, the one I mentioned for the cardiac calcium levels. Full body detox, and it also lowers.
That helps you with a full body detox,
Yeah.
or you do a full body detox?
It helps you with a full body detox.
I love this.
Yeah,
Okay.
with no side effects. You just have to drink a lot of water and flush your system.
Do you do it
afterwards.
over time, or is it like a short period of
It's
time?
just another 500
Oh, it's an
milligram
IV.
bag.
It's an IV.
Oh.
Yeah, super
wow.
easy, no side. You know how NAD could have some negative side
Yeah.
effects during the infusion. This has none.
We should
Oh,
have
we
had
should
you
have had.
do.
Oh my God, the bags. We could just be here for another hour.
We could have had
easy.
you do them
Yeah.
while we were on
Yeah.
this.
We'll do it all.
We
We'll
need to have
shoot
you
another
come back.
anything.
Yeah.
We'll take anything. Yeah.
So I was doing that full IV experience that I just mentioned, the NAD and the ALA and the vitamins twice a month. And then my full peptide routine, I'd gotten to a point where I was just managing my weight with GLP-1 and doing it still for the microdosing benefits of the decrease in inflammation and all the things we mentioned earlier. And I was very comfortable on tirzepatide, so I didn't do the retatrutide. I didn't want to mix it up at that point. And I was on rotating cycle of like 15 different peptides. So it would just, I would take like 3 in the morning, 2 in the afternoon, 2 at night. And then after a few months, you cycle off.
You look great.
That's a
Add
good
more
question because you
Yeah.
people take supplements and they're on it forever, but I've heard that you should cycle. So
Yeah.
how do you know what the timing is?
So the theory behind doing 5 days on, 2 days off is that you're giving your cell receptors a break. So you're not getting receptor fatigue, meaning you would need more of the medication in order to get the same result. So
that's enough of a break, just taking like your weekend off.
that allows you to do more cycles before completely cycling off.
Okay.
So For example, let's talk about the GHKCU. If you're doing it Monday through Friday, taking weekends off, not only is that easier for you also to take a little break from shots every single day, but you could do a couple vials, meaning 2 or 3 months worth of GHKCU before needing to take a full month off. Whereas if you were doing it 5 or 7 days a week, you're going to do like a 50-day on, 50-day off cycle because you're doing it every single day and your receptors are getting fatigued. So it just extends the kind of amount of time that you're allowed or able to inject this and have effective results. So that's how I do it for my clients. And it depends on their health status. But we're just assuming that someone is generally healthy, doesn't have any other issues going on.
What issues are you looking for?
Let's say they just had surgery or something of that nature. They're in a recovery phase. I will kind of give their bodies a little bit more of a break sooner. So probably only do 2 rounds and then do a month off. Or if they're just generally, if their lab work is off, and we're, working to get their hemoglobin A1C in order, let's say, and we have them on a GLP-1. And their hormones aren't balanced. That's another huge one. Even though I'm not managing hormones, if their hormones are off, I can only do so much with peptides.
Right.
So it's only going to meet you kind of where you are.
Do you check those hormones or do you
I still
refer
check
out
them. And
okay.
then, so I see them, I understand what's going on, and then I refer out for them to be prescribed how to fix them.
Okay.
And so if they're working to get those balanced, then again, they're going to get a shorter cycle on of each of the peptides, just so that their system's not overwhelmed. And autoimmune. If someone has an autoimmune issue, definitely very short cycles, usually 1 on, 1 off.
But they're still autoimmune, they're still okay to go on all these types of peptides?
There's
or is there more caution around that?
More caution around that. So something like a GLP-1 helps with autoimmune issues too. So we would microdose that and see how they do.
It's like a miracle.
It really
It's a miracle.
And also it helps with addiction.
Yes, because it's dulling the pleasure sensors in our brain, essentially, mostly around satiety or like hunger. But
Does it dull it for sex as well?
That's a great question. I don't know.
Because if it's dulling the pleasure center, like there's a lot, but because I've tried it and it's never dulled my shopping pleasure. So I think it's fine.
Yeah. But why is it working with alcohol and drugs?
Sex is that if you're getting the puffy pussy,
Yeah.
more blood flow,
Yeah.
meaning more sexual pleasure.
Right.
So maybe you just ignore the aesthetics of it
Yeah.
or do
Just
another
get
treatment.
bigger size-
You
Just
don't
get a
wear
bigger
tight
size pants. Yeah.
You don't wear tight pants.
Pleated pants, ladies.
Yeah.
A harem, a drop crotch.
There's always a trade-off somewhere.
Exactly.
Why is she in harem pants all the time now?
I don't know, but she seems happy.
And he's happy.
Yeah, her husband's really buying her a lot of stuff lately.
Makes sense. So good.
God, this stuff is so fun.
I know.
So fun.
It's really amazing because health is the new luxury.
Yes.
Things are changing.
true.
People are going to dinner early. There's no more like 8 p.m. reservations. Everybody wants the 6 p.m. dinner reservations. They want to be healthy. They want to be vibrant.
Yes.
And it's
no one's
incredible.
drinking as much.
Yeah.
Right. No one's
Or
drinking
a
as
lot.
much.
Most people are cutting back a lot. Everyone wants to feel good and they want to look good. And yeah, longevity is a luxury, and it's not just aesthetics. There's the huge, we've talked about the Kardashians multiple times, but when they came out and there was all the overdone and everything, and aesthetics was this new boom of an industry, and no one was really focusing on the inside. And now we have all this research, all this science on how we can also optimize ourselves and not only feel our best, but in turn look our best because of that. It's just, that's the only way to go about it. You can't slap
incredible.
a Band-Aid on it with, injectables. You can, but it's not going to give you the same glow as if you feel really good and everything's functioning great.
I have a question. How do you feel about stem cells? Like, how people are going and getting like these, like the Kardashians just went, I think they went to Canada and did like the stem cell treatments. And I have a friend of mine who did it. He said he felt incredible.
Yeah.
Incredible. He went for something very specific, like an injury that he has. But, I don't know if they have enough data around it and the cost to go and do it.
Yeah.
And the thing that always worried me is like, I don't know the research, like if you're putting all those stem cells in you, because they have to put like millions, right?
Yeah.
To get a benefit. What if it has a negative reaction? It's not like a peptide where it leaves you.
Right.
Do you like them? Do you think that they have long-term health? Are they the fountain of youth?
So, great question. In full transparency, that's one of the treatments I've never tried personally, and very curious about. So I can't speak to it like amidst my own patients or anything like that. Just as another curious consumer, I feel like and I have friends who've done it and seen amazing results for injuries.
Yeah.
Like I've seen it on an x-ray completely heal the spine, and where there were gaps between, the fluid was gone and they're bone on bone, it comes back. And it's just, I'm seeing
Tissue regrows.
Tissue regrows.
Wow.
And
So like, why wouldn't that
be good?
right? Or like, but for the fountain of youth, like, it's almost like you're regenerating all this greatness.
Well, you
in your
are,
body.
because stem cells can proliferate or become any cell in the body. That's why they're so fascinating. And so, that's what's happening a lot when you're making a human, because it can become any single part of the body. Normally there's very tissue specific cells. And so stem cells can go and heal anything. And the issue with, and why people are scared around stem cells, is because you're infusing a foreign body. So the potential for an allergic reaction, which has happened, is something that, that's why people are hesitant. But you need, just like with anything, just like with peptides, you need to know your source, and you need to know where you're getting it from.
Somewhere reputable. But what, like, if you do have an alert, I mean, I don't know enough people that I'd be the one person struck by lightning that would have the allergic reaction
to a stem cell.
Yeah.
No,
But
maybe it won't last that long. Try it.
it sounds like it's in your body regenerating for a long, I think forever, right?
6 months.
The whole,
It's a 6-month cycle is what they say, that you'd want to do it every 6 months. Yeah.
wow. I'm down.
Well, I'm excited to try this.
I would go to the Bahamas.
I'm excited to try. What are we shooting ourselves up with?
NAD.
NAD?
Yeah.
Gonna do that
But we don't
NAD?
have an alcohol swab. Is that okay?
As long as you shower today, you'll be okay. It's a shallow injection.
Yeah, I'm fine. I've done
didn't
that
shower.
many times without wiping myself down.
I put lotion on after showering though.
That's gonna be okay.
It is?
Because it's so superficial.
Well, while we're doing this, I just want to say that you are fresh, vibrant, so intelligent.
Thank you.
Makes
So beautiful.
me feel
Thank
so
you.
comfortable understanding what this whole peptide revolution is, because health is the ultimate luxury, and we will have whatever you are injecting.
Yeah. Thank you for being here.
Thanks for having
Yeah.
me.